Hi, I'm David Mack III with the Committee on Better Racial Assurance Sickle Cell Anemia Program, and this is another one of our empowerment series that we have where we give folks information. It's designed for individuals and families affected by sickle cell anemia, sickle cell disease, but other folks can benefit from this information also. It'll be around 15 minutes, maybe a little bit longer, but it's not going to be a long, but we want to be able to really get you some pertinent information. Now, of course, what's everybody talking about now? The vaccine. The vaccine that has come up as relates to dealing with the coronavirus. First people on the list, as we've heard, workers in essential and critical industries in the healthcare industry. These will include doctors, nurses, people working in nursing homes, people working in emergency rooms, home health personnel. As you've probably seen on the news, they have been getting the vaccination first, and rightfully so. They're on the front line. The stress that they have been dealing with has just been unbelievable. They've been a blessing. They've been a true blessing to us all in terms of being in there, serving people, fighting this disease. Next on the list with the vaccine, people at high risk for severe COVID-19 illnesses due to underlying medical conditions. What are these? Heart failure, heart disease, cancer, sickle cell disease. That's high on the list. Also, if folks have out of control diabetes, hypertension, obesity, these are some of the things that, again, underlying medical conditions that make folks more vulnerable to succumbing to the virus. So they're next up. To our patients and families affected by sickle cell disease, I urge you to consult, stay in communication with your physician, and get information as relates to this vaccine. And please adhere to that information, which means you should be in line to, in fact, get the vaccine. The next group they're looking at is folks ages 65 and older. Now, there's been a lot of conspiracy information out there as relates to all vaccines. All we have to do is think about polio, hepatitis B, hepatitis C, rabies. There's been a lot of diseases, a lot of illnesses that have been combated with the vaccine. Polio being number one. So please, let's not fall into this category where we're nervous as relates to getting this vaccine. Follow your doctor's orders. Also, let's go through the regular list. Wear a mask. People like to say socially distance. We like to say physically distance. Physically distance. Wash hands. Wipe down surfaces. We know it's the holiday season. We know there's still people having a lot of different things. I know there's the temptation to have your normal family gatherings. You cannot do that. You don't want to do that at this point. The virus is surging. The state of South Carolina has hit some record numbers, as along with some other places around the country. So please, let's practice the discipline of doing that which we have to do while the virus comes on board. One of the things that I looked at very carefully was how Dr. Fauci was so excited about these vaccines. In his words, the cavalry is coming, and having a big smile on his face. That's all I need. I've spoken to my physician, local physicians, healthcare professionals. They're lining up to take it. This is important. So again, as I conclude, plug into your physician, get information as relates to this vaccine, and don't hesitate to take it. Don't hesitate to take it. And don't get careless over the holiday season. We're in the midst of it right now. Physically distancing is a key. Wearing a mask is a key. Washing your hands, wiping down surfaces. Now is not the time to be in crowds, even large family gatherings. You don't want to do that. You don't want to do that. So let's focus. Let's be disciplined. Let's do that which we need to do. And again, this is designed for individuals and families dealing with sickle cell disease. But by the same token, everybody can benefit from this information. Again, this is David Mack III with the Committee on Better Racial Assurance Sickle Cell Anemia Program, the Empowerment Series. Thank you.